In this video, I'm going to show you how to do the best exercise for treating your shoulder pain. If I were stuck on a desert island, I would bring this exercise with me. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro. And in this video, I'm going to show you how to do an exercise called repeated shoulder extension. This is by far my favorite exercise for treating shoulder pain. If I were stuck on a desert island, I would bring this one with me. The reason I say that is because it's what works for me, and this is the exercise that helps the majority of my patients that I see with shoulder pain. It's amazing, it's powerful, and I want to show you how to do it. This exercise is pretty easy to do and you can do it anywhere. I'm going to show you 3 different variations of it to make sure that you can do it anywhere. I have the chairs stacked up here because this isn't a high enough surface. If you had a really high countertop, that'd be great. Usually they're not that high, so you have to put a chair up or stack some books or a crate, something like that. I'm putting some pillows on just to make it more comfortable. I'm going to say I have right-sided shoulder pain. Your shoulders are square to the chair behind you. You take your hand to the side that's hurting, you put it on the chair, palm up. Feet are about shoulder and hip width apart, maybe a little wider. This other hand, I'm going to take and put it behind my back. That's to help ensure that my shoulders stay square, that I don't turn. And you're just going to squat down as far as you can. There, and then back. Keeping the shoulders square. I squat down, and then back. Just do this rhythmically. Down, and then back. Down, and then back. Down, and then back. 10 to 15 repetitions. If you don't have a high enough counter, or a space that is high enough where you can put your arm in and do that stretch I just showed you, another option is putting your hand on the wall. It's pretty effective. In fact, it's almost equally effective, but you got to worry about your hand slipping and sliding on the wall. But if you're to do it that way, same thing, shoulders stay square. You're going to put your hand, fingers down, put your palm against the door or wall. Other hand goes behind your back. See, I just slipped. Other hand goes behind your back, and you squat down. Again, making sure that you don't lose that angle. Here and up, down, up, down, up. Slow, rhythmical fashion. Each time, I'm trying to go a little farther into my range. 10 to 15 repetitions. It should feel better as you do it. A third option for this, if you don't have wall space or something, is you could use a door jamb. All right? So I'm going to actually take the framing of the door, put my hand on it this way. Again, this one you're having to grip, even more so than when you put your hand on the wall, so I don't quite like it as much. And my thumb is pointed downward, whereas in the other versions, your palm is upward, and that's ideal. But if for some reason you don't got wall or door space, of course I guess if you have a door frame, you're going to have door space. But if you don't have a wall or you don't have something to put your hand on, you don't have a high counter, here's another option. So this time your thumb's going to have to be downward. Grip up here on the door frame. Other hand's behind my back. Shoulders and hips stay square. And down I go. Down I go, and then back. Down I go. Each time trying to get farther and farther and farther. There we go, 10 to 15 reps. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsboro, showing you how to do repeated shoulder extension. 3 different versions. The dosing for repeated shoulder extension is 10 to 15 repetitions every 3 to 4 hours. Be consistent with it, and within a matter of days to a week or a little more, you're going to feel better for longer and longer periods of time, and you'll have to do the exercise less and less. You might get to the point where you're only doing it once a day or a few times a week. If you're an athlete, I would also encourage you to do this exercise before and after your workouts. So for instance, for me, when I do chin-ups, my shoulder does not like that very much. If I do this exercise as a warm-up, do a bunch of chin-ups, and then as my cool down, I'm fine, no pain. Some people with more acute pain, they might have to do 10 to 15 reps between each set of the aggravating exercise. If you like what you've seen in this video, subscribe to our YouTube channel and click on the little bell. That way you'll be notified each time we upload a new video showing you how to do one of these powerful exercises for getting rid of pain in your life. Like the video, share the video with your friends, and leave comments below. Let us know if you've tried this exercise and how it's worked for you. If it's helped you, let us know how. If you've tried it and it didn't work or made you worse, let us know that as well, because then we can suggest modifications to this exercise which might make it more beneficial to you, or we can suggest another exercise that might be more appropriate for you.